Welcome. In this training video, we'll explore how to support primary school children who experience severe mental health challenges. These challenges can significantly affect a child's daily functioning, learning, emotions, and relationships. Today, we will look at understanding severe mental illness in children's science teachers may notice effective classroom strategies collaboration with families when to seek additional support. A closing message for educators: your role is incredibly important, and your support can change the trajectory of a child's life. Severe mental illness in young children is rare, but when it occurs, it can deeply interfere with everyday functioning. These conditions may involve intense emotional dysregulation, chronic, severe anxiety or depression symptoms, complex trauma responses, severe behavioral disturbances, mental health conditions that limit participation in school routines. Severe mental illness in children affects several areas of functioning: emotional, social, cognitive, and physical. Is persistent without significant support, requires coordinated care between school, family, and mental health professionals. Children often cannot explain their inner experiences verbally, so adults must pay close attention to behavioral cues and changes over time. Teachers are uniquely positioned to notice patterns. Signs of severe mental illness can include 1. Emotional indicators: intense, overwhelming fear, sadness, or anger. Emotional responses far beyond what is typical for age, frequent crying or sudden emotional shutdowns. 2. Behavioral indicators: unpredictable or extreme behavior shifts, significant withdrawal from peers or adults, repeated aggression that is not responsive to typical interventions, running away, hiding, or freezing under stress. 3. Cognitive/academic indicators: marked difficulty concentrating or staying on task, severe drop in academic engagement, difficulty processing instructions even when simplified. 4. Physical and somatic indicators: frequent headaches or stomach aches without medical cause, extreme fatigue or restlessness, noticeable changes in appetite or sleepiness at school. 5. Social indicators: inability to form or maintain friendships, strong mistrust of adults, distress during group activities or transitions. These signs take on meaning when they are persistent, intense, and significantly impact learning or safety. While severe mental illness requires clinical support, educators can create stabilizing environments. Effective strategies include 1. Predictable structure and routine: use highly consistent schedules, provide visual supports for transitions, offer advance notice for changes. 2. Emotion regulation supports: calm down corners or safe retreat spaces, or giving frequent breaks, teacher-led grounding exercises, clear, gentle emotional modeling. 3. Instructional adjustments: break tasks into small, manageable steps, provide one instruction at a time, offer flexible pacing and alternative formats. 4. Behavioral supports: avoid power struggles, prioritize safety and de-escalation, use neutral, calm responses, reinforce small successes, have a team-wide, agreed-upon behavior plan. 5. Sensory and environmental supports: options for quiet seating, noise-canceling headphones, or fidget tools, reduced visual or auditory distractions, short movement breaks. 6. Relationship building: warm, consistent interactions, regular check-ins, letting the child know they are valued even on difficult days. These approaches don't replace clinical care, but they significantly increase the child's stability and ability to participate. Families are essential partners in supporting a child with severe mental illness. Collaborating effectively includes approaching families with empathy, not judgment, recognizing the stress, worry, and exhaustion caregivers may face, sharing school observations using specific, neutral language, asking caregivers what strategies work at home, maintaining consistent communication through diaries, calls, or meetings, respecting cultural backgrounds and family values, encouraging families to engage with pediatricians, psychologists, or therapists. When families and schools communicate openly, children receive predictable, aligned support across settings. There are clear times when additional support is needed. Seek help when the child's behavior poses safety risks to themselves or other symptoms are worsening or lasting more than several weeks. The child is unable to participate in learning despite support. There are signs of trauma, extreme withdrawal, or intense distress. You feel unsure how to proceed. Families request additional support. School-based options may include school counselor, school psychologist, special educator, or behavior specialist multidisciplinary student support team community, and clinical supports may include pediatric or psychiatric assessment, outpatient therapy, crisis intervention services, community mental health programs, early identification, and coordinated care help prevent crises and improve long-term outcomes. Supporting a primary-age child with severe mental illness can be challenging, but you are not alone, and neither are they. Your calm presence, structured environment, and willingness to collaborate can make school feel safe and predictable. Your observations guide families and professionals toward the help a child needs. Thank you for your commitment to creating compassionate classrooms where every child feels seen, understood, and supported.